while the next 30 kilometers towards core are under implementation. Works are also progressing on the Manyatajilo-Gororokesa corridor in Saku, the Sololo Town Madwadi Wayegoda Road in Moyale, North Hordukana Road, and North Ilele Road are not ordinary roads. They are lifetime for trade, security, health access, education, and social connection in a county where distance has often been one of the greatest barriers to development. We are also raising the standard of our strategic roads. The 13-kilometer Sololo Anona Golole Uran Road has been launched for upgrading to low-volume seal bitumen standard. In Saku, the key Marsabit urban corridor from Old Slaughterhouse through Marsabit Market, Lakabaricha, Kiwanja Ndege, War Cemetery, and Golf Hotel Junction is being prepared for tarmac upgrading. Although these strategic roads investments are valued at more than 1.5 billion and will ease movement and lower cost of doing business, support emergency response, they will also improve access to markets and services. We also know that the recent heavy rains damaged sections of our road network in various parts of the county. In response, the Department of Roads has undertaken a road inventory and condition survey to identify and prioritize the most affected routes. Nyaya Road, for example, in Central Ward has already been prioritized, and other critical roads are being addressed through ward priority projects and maintenance programs. In health, ladies and gentlemen, we have continued to strengthen both infrastructure and service delivery. The completion of Sololo Level 4, for example, is a major milestone in expanding access to higher level care in Moyale and the wider northern corridor. We have also advanced health development program of more than Kenya shillings 200 million this financial year, covering facility improvement, equipment, laboratory support, maternity services, staff housing, solarization, water connection, fencing, incinerators, and other essential medical infrastructure across our great county and in all the wards. At Marsabit County Teaching and Referral Hospital, for example, dialysis services have remained operational, helping patients manage renal conditions closer home and reducing burden of costly referrals. We are also advancing investments in diagnostic activities, or rather equipments, blood bank in strengthening, cancer care support equipment, and renal services, as I already mentioned. Across the county, facilities such as Loglogo, Kamatoni, Karungu, Moyale Level 4, Maternity, Balesa Saru, El Boro, Magado, Aibete, Boruharo, Songa, Karare, and others are benefiting from ongoing improvements, equipping or operationalization support. Beyond buildings, we are also strengthening prevention and community level care through partnership between the county government and the National Ministry of Health. 1,983 community health volunteers have been placed on stipends. Vaccine distribution has reached 121 health facilities with all required antigens, while blood donation drives have collected about 3,000 pins to support transfusion services. Maternal and perinatal death audits, disease surveillance, One Health sensitization, malaria case management training, food safety inspections, school health inspections, and public health radio programs have also been improved. These interventions, ladies and gentlemen, show that we are not only treating illnesses, we are also building a county health system that prevents diseases, responds early, protects mothers and children, and serves people closer to their homes. Ladies and gentlemen, in water, agriculture, and pastoral livelihoods, we have continued to invest in the productive base of our county. Marsabit is an arid and semi-arid county system schemes, extended pipelines, rehabilitated shallow wells, promoted household water harvesting, solarization of water systems, and strengthened water infrastructure for both domestic and livestock use. Interventions such as Bakuli 4, which is now complete, and redistribution within SACU is going on. Colbot, Badanarero, Kishewan, Harare, Sesela, Sololo flood mitigation, and several borehole and pipeline projects demonstrate our commitment to reducing the burden of water scarcity across the county. Now, through the support of World Bank, a project called Horn of Africa, Groundwater, in collaboration with national government, your county government is in a program to ensure that water is brought closer home. Not only the boreholes, but this water from boreholes are connected to our homes. In phase 1 of that program, Lot 1, Jaldesa, Kamboy, Loglogo, Laisamis, Lengima, at a cost of 430 million, this work now is ongoing. At batch 2, a place called Maikona, Gamura, Marime, Malabot, Ileret, Golole, at a cost of 330 million, connection of water, 100 million, ladies and gentlemen. Rehabilitation of water supply to Moyale has been designed and completed, and shortly it will be advertised. Jirime and Mataharba boreholes also equipped. Over the past year, we have drilled and equipped boreholes, constructed water pumps, and as I have already said, in agriculture, livestock and fisheries, we have treated food security not as a slogan, but as a practical development agenda. We have supported farmer producer organizations and SACCOs so that farmers and pastoralists can aggregate produce, access markets, improve bargaining power, and increase household income. Particularly, focus has been placed on our priority value chains: milk, meat, fish, honey, and beans. We have expanded extension services through agriculture extension officers and agricultural engineer and agripreneurs, and developed key policy instruments, including the agriculture sector strategy, food security and nutrition policy, youth agripreneurship policy, and rangeland management policy. Ladies and gentlemen, livestock remains the backbone of our county economy. We have therefore continued to support livestock sector, vaccination, range management, market development, and value addition. More than 15 livestock markets have been developed or improved, strengthening trade and supporting pastoral livelihoods. We have also expanded programs to commence irrigation and climate-smart agriculture in areas such as Lataka, Nokatu, Kalacha, Bura, Songa, and Kubikalo, through drought-tolerant seeds, fruit tree seedlings, agroforestry, for commencement in the next 3 weeks, so that we can begin a county that mainly exports raw products to a county that increasingly processes, packages, and benefits from the value of what it produces. At Oda, we are advancing the development of an industrial park that will support processing, packaging, cold storage, and light manufacturing, especially in livestock, dairy, hides, and skins, and agro products. This is important because our people should not remain at the lowest end of the value chain. The pastoralist who produces livestock, the farmer who produces food market, represents a practical economic chain. Producers need efficient markets, traders need decent trading spaces, processors and need reliable facilities, young people need jobs, investors need confidence, and the county needs a stronger revenue base to reinvest in roads, water, health, education, and other services. We are giving that particular attention because of the 100 million population that we are bordering at Kenya-Ethiopia border, so that we can tap into that economy. This is Madaraka expressed through economic self-reliance, ladies and gentlemen. Boreholes and in water-stressed areas, drilling of water ponds, livestock breed improvement, restocking, support to women and youth groups in agriculture, mini irrigation schemes, tree planting, and land restoration. These interventions will improve access to water, restore degraded land, diversify livelihoods, protect livestock-based incomes,